Welcome back to KETV News Watch 7's Chronicle. I'm Bill Shammert. This morning we are talking about heart health, and local firefighters say your phone could be a powerful tool in saving a life. Chronicle's Pete Cudahy explains how one app is turning everyday people into first responders.
With the help of an app, the Tri-County Fire and EMS agencies are empowering you to help save lives. They say rather than waiting for first responders to come, by downloading an app, you can be a hero. With the PulsePoint app on your phone, that's what you hear when there's a cardiac arrest nearby.
For every minute that a patient's heart stops, they decrease their chances of survival by 10%.
It's part of the effort from Douglas, Sarpy, and Washington County to let civilians help save lives.
It mobilizes them to become a bystander rescuer.
By the time an EMS unit arrives in most of our bigger locations or bigger cities, you're 4 to 6 minutes into that. So they're already almost 50% decreased survival rates.
You don't need any CPR training. The app walks you through exactly what to do.
If there's a PulsePoint responder, you, for example, are within a quarter mile of that victim, your phone will go off, and you'll be able to look at it, and it will show you a map guiding you to the victim, and then it will also show you where the closest AED is.
Here in Omaha, fewer than 50% of victims of cardiac arrest receive bystander CPR. Places already using PulsePoint tell a different story.
There are some communities, such as Lincoln, that have bystander CPR rates above 70%.
The Tri-County Fire and EMS agencies hope that by simply downloading the app,
potentially dozens, if not hundreds of people could be saved through an effective bystander CPR campaign.
The app will launch to the public on February 14th, so on Valentine's Day, you too can save a life. Reporting from Omaha, I'm Pete Cudahy, KETV News Watch 7.
Joining me now is Dave Keever from Omaha Fire and Chad Nixon from the Bennington Fire Department. Thanks for joining us, gentlemen.
Thank you.
PulsePoint, I imagine it takes a lot of work to bring an app like this to our community. How did this get started?
Well, Chad and I about a year ago came together and decided that this was something we were going to tackle, and you're right, it's a big job. We knew right away that we wanted to bring in some help. We formed a collaborative group with local fire departments as well as other nonprofits and businesses and the hospital systems in Omaha, and we set to work on it. A lot of research, a lot of communication, collaboration, and fundraising, and here we are.
Chad, how does this work? Let's use a real life example. I'm at a strip mall and I'm shopping and somebody nearby goes into cardiac arrest. How does this app help?
Yep, so if you have selected that you're willing to respond in the app, you'll get an alert to your phone, and I use the analogy, it's almost like an Amber Alert, where that your phone is going to go off and it's going to alert you to that nearby cardiac arrest. You'll be able to then follow to where the patient is, and you'll be able to locate the closest AED to where you are to that location.
If I tense up in a situation or don't know what to do when it comes to CPR, does it guide you through everything, Dave?
So the app does have some features on it that will guide you. It'll give you like a metronome for the rate of compressions and things like that. So that's a huge benefit. But in addition to that too, we would always encourage people to also then get on the phone with our dispatch centers. We have great dispatch centers with telecommunicator CPR enabled dispatchers. They will coach you. They'll tell you how hard, how deep, and how fast to push during your compression. So a lot of peace of mind there as well.
TCPR now required in the state of Nebraska,
correct, yes.
Which is really important. So as far as the app goes, the launch date is February, I mean, that's coming up soon, right? February 14th?
Correct. Yeah, February 14th.
Most people have seen AED boxes before, but may not know how they work. The app will walk you through that, Chad?
Yeah, so the app will show you the location of the closest AED. And the good thing about all of the AEDs is that the AED itself will walk you through the steps required.
Of course, yeah.
So even just opening the container and turning it on, it'll start to walk you through step by step what you need to do in order to prep that patient for the defibrillation.
I heard you mention survival or bystander CPR rates is less than 50%. I know you've probably done a lot of research on this. Dave, why do you think that is?
You know, I think it's a lot of people have good intentions and they really want to get involved and want to help their neighbors. But I don't know if, number one, I don't know if they always know, of course, when the cardiac arrest has occurred nearby. That's the power of this tool, right? So even somebody who's been through a class or who has the wherewithal to help somebody, how do they know if somebody in the shop next door, as you mentioned, is in cardiac arrest? They're just unaware. So we're going to bridge that gap with this tool. And then we're also going to work with the AHA, National Safety Council, and others to continue getting out in the community and teaching more CPR through those organizations and through our own public education departments within the fire departments.
Chad, how important is getting hands on a chest when somebody's in cardiac arrest?
It's crucial. If there's any chance of survival, the early chest compressions is what's going to continue perfusion through the body and allow an early defibrillation to work. And then it's also buying the EMS a little bit of time in order for us to arrive on location. Or for us as well, law enforcement's another big piece that plays into this. So a law enforcement officer may be 2 to 3 minutes ahead of EMS even because they're already out in the community. So what that's doing is keeping that pump primed so that we have the ability to defibrillate the patient and hopefully get a return of spontaneous circulation quicker.
Dave, we only have about 30 seconds left. How do you expect the community to embrace this? Do you have any goals?
We're very excited. We've just now started talking about it, and it's already been well received. We have so many people interested and excited about this. We have so many great organizations involved to kind of help it word get out. So I think it's going to be very popular here. It's been popular in Lincoln, and I foresee a great launch here and a lot of success.
Of course, free of charge. There's no cost to download this.
Correct.
All right, thanks for joining us today, guys.
Thank you.
Thank you.
23,000 kids experience cardiac arrest outside of the hospital every year. Now, there's a bill in the Nebraska legislature aiming to bring that number down by protecting student athletes. LB 463 would require comprehensive plans designed to help students, faculty, and staff save lives in an emergency. Chronicles' Eddie Messel breaks it down.
It is estimated that about 23,000 children 18 and under experience cardiac arrest outside of a hospital. Approximately 40% of those events are sports related.
CPR is great. That is just buying time until somebody can get that heart reset electrically. And so that's where AEDs and knowing how to use them really matter.
LB 463 requires schools statewide to have a cardiac emergency response plan.
Just like a tornado drill or a fire drill or something like that, where we want them to know how to recognize symptoms of an electrical problem of the heart and what to do about it.
Dr. Matt Sorensen, a pediatric electrophysiologist at Children's Nebraska, is also the medical director of Project Atom, an initiative to add defibrillators in schools. Sorensen says saving lives is all about timing.
Our goal is to be able to have people implement that and recognize it and start those steps to hopefully get them shocked within 3 minutes.
Success stories like Memphis Zabawa, now a freshman at Scott Catholic, whose life was saved by the quick thinking of bystanders at a cross-country meet back in 2023.
Ultimately, because someone saw him collapse, she started CPR right away, and that saved his life.
Memphis's mother, Erin, has become a major supporter of LB 463. States across the country require a mixture of 3 different policies in schools. Do you require an AED? Do you teach people how to use them? And is there an emergency response plan?
There are 4 that don't have any of those policies passed into law. And it's sad to see Nebraska as one of those 4.
Zabawa's message to those debating on LB 463?
It really is a no-brainer. It's about saving lives. It shouldn't be about any sort of time constraints or money constraints. It's about saving lives, helping people.
If LB 463 is passed, the grant will be funded by no more than $1.5 million from the Medicaid Managed Care Excess Profit Fund. Reporting in the newsroom, Eddie Messel, KTV, Newswatch 7.
LB 463 cleared the first round of voting last month, 25-15. It's now on to select file, or the second round. It still needs 2 more votes and the governor's signature to become law. First, a reminder that your comments are an important part of this show. If you want to be heard, email those comments to news@ketv.com. Remember, we love hearing from you. We'll be right back.